In the body, there is a collection of glands that secrete hormones which control and regulate the majority of the body's day-to-day processes. This collection of glands is called the endocrine system. Different tissues, muscles, and organs rely on these chemicals produced by the endocrine system in order to know what to do. One of the most notable organs in this system is the pancreas, responsible for releasing insulin that controls glucose levels. But what exactly happens when this function is impaired? This is what we are here to discuss today, the epidemic of diabetes mellitus.
Let us first start with what is diabetes. Diabetes is a more common term of diabetes mellitus. The disease is a chronic, long-lasting health condition that affects how your body turns food into energy. It is caused by a deficiency of insulin or a decreased response to insulin in target tissues. Here, the blood glucose level rises, but cells are unable to take up enough glucose to meet metabolic needs. Instead, fat becomes the main substrate for cellular respiration. Diabetes develops when the body cannot make enough insulin or use it properly. Insulin is a hormone that helps regulate blood glucose levels, and without a sufficient amount working correctly, health complications can occur. Before we talk about common and uncommon kinds of diabetes, there's a term for those who have borderline diabetes, and this is called prediabetes. Prediabetes occurs before type 2 diabetes develops. By this stage, blood sugar, blood pressure, and insulin resistance may start reaching harmful levels. The more common kinds of diabetes are type 1, type 2, and gestational diabetes. Type 1 diabetes or insulin-dependent diabetes is an autoimmune disorder in which the immune system destroys the beta cells of the pancreas. It usually appears during childhood and destroys the person's ability to produce insulin. Type 2 diabetes or non-insulin-dependent diabetes is characterized by a failure of target cells to respond normally to insulin. Insulin is produced, but target cells fail to take up glucose from the blood, and blood glucose levels remain elevated. Although heredity can play a role in type 2 diabetes, excess body weight and lack of exercise significantly increase the risk of developing this disease. It generally appears after age 40, but even children can develop the disease, particularly if they are overweight and sedentary. Based on statistics, more than 90% of people with diabetes have type 2. Lastly, the gestational diabetes develops in pregnant women who have never had diabetes. It usually goes away after the baby is born. However, it increases the mother's risk for type 2 diabetes later in life. The baby is also more likely to have obesity as a child or teen and develop type 2 diabetes later in life. And here is the list for the less common kinds of diabetes.
Now let's look at the current epidemiology of diabetes in the Philippines. According to the International Diabetes Atlas, as of 2021, 7.1% of adults ages 20 to 79 have been diagnosed with diabetes, which equates to around 4.3 to 4.7 million Filipinos. It is predicted that 2.8 million Filipinos are still undiagnosed. For ages 0 to 19, there are 3,900 patients with type 1 diabetes. In the Philippines, type 2 is more common, accounting for 3.7 million diabetics even way back in 2017. In terms of mortality caused by diabetes, there were over 32,000 deaths caused by diabetes in 2021, making it the fifth leading cause of death in the Philippines. Among those deaths, only 4% were of those aged below 60. We'll also briefly tackle the annual costs per patient with diabetes. Findings from a paper stated that for two major hospitals in the Philippines, the direct hospital costs ranged from $127 to $2,242 for those without complications, and $621 to $3,226 for those with complications. Note that other purchases, procedures, and practices were omitted from this study. For diabetes, these are the different factors attributed to it according to the CDC. Type 1, family history and age, since it often begins during childhood. Type 2, having pre-diabetes, being overweight, being aged 45 and up, being related to someone with type 2 diabetes, and being less active. Other factors include modernization and technology, which has promoted a sedentary lifestyle, and diabetes care in the Philippines being deprived in terms of resources, government support, and economics. Also, recently due to the pandemic, some papers theorize that proper diets and physical activity are inhibited due to the lockdowns restricting access and mobility. Now, based on this information, we are able to see the most vulnerable age group for the more common diabetes are those who are 45 and up, with some papers specifically noting the range of 45 to 64 for type 2 diabetes.
Now, how do we take care of people with diabetes? Of course, we must get a better understanding of diabetes, which includes realizing that each person with the disease is unique and that their treatment plan must be tailored to meet their individual requirements. If you have a child with diabetes, you'll probably be much more involved with their day-to-day care. Some older kids will be comfortable checking their own blood sugar, injecting insulin, and adjusting levels if they use an insulin pump. Younger kids and those who just found out they have diabetes will need help with everyday diabetes care. Older people are more likely to have diabetes and managing it can be challenging for them. It's crucial for you to understand the symptoms and how to respond to high or low blood sugar levels because older people may not be as able to detect them. Most diabetics already follow their own regular schedules. Some people only need cues and reminders, others require no assistance at all. The Philippines have been gradually building comprehensive programs for diabetes care despite the lack of funding and support provided by the national healthcare system. The Insulin Medicine Access Program, INMAP, a public-private collaboration to deliver inexpensive insulin, was introduced by the Philippine Department of Health in 2009. Pharmaceutical companies supply insulin through consignment agreements with 22 hospitals across the nation as part of INMAP. The Health Technology Assessment Council, HTAC, was established by the Philippines Universal Healthcare Act, which was implemented in 2019. HTAC is aiming to incorporate insulin analogs in the Philippine formulary in an effort to reduce these expenses and gain negotiating influence with the government. The Philippine DOH has been developing a national diabetes prevention and control plan since the late 1990s in an effort to reduce the mortality and morbidity caused by this chronic illness. The later integrated community-based non-communicable disease prevention and control project, which was implemented in numerous Philippine cities and municipalities, included diabetes management as a component. This featured the Good Lifestyle (HL) campaign, which aimed to raise consciousness about healthy eating, regular exercise, and lifestyle choices. Now, I have mentioned earlier that there are different treatment regimens for people with diabetes. Since everyone is different, so treatment will vary depending on their own individual needs. There are two possible treatments for people with type 1 diabetes. The first one is insulin pumps or pen. The second one is islet cell transplant. This could stop them from experiencing severe hypos. On the other hand, there are more treatments for people with type 2 diabetes. First, tablets and medication, which may help manage their blood sugar levels. Weight loss surgery is also an option. There have been lots of studies that have found that this can help to put type 2 diabetes into remission. Third, diet and exercise. Lots of people with type 2 diabetes don't take any medication and they instead treat their diabetes by eating well and moving more. Insulin is also an option, however, if they have type 2 diabetes, they may not need to use insulin straight away. If they have another type of diabetes, their treatment options may be different.
We hope that you have learned something today and realized just how important our endocrine system is. Furthermore, how important it is that we take care of ourselves and push for a better healthcare system here in the Philippines to properly address the epidemic of diabetes mellitus. All of our research references have been compiled into a QR code if anyone is interested in further reading. Thank you so much for watching and God bless.